Hi, my name is Cecilia Wen, and my capstone is over pressure ulcers and paraplegics. Pressure ulcers are injuries to the skin and underlying tissue due to prolonged pressure. Because of the prevalence of pressure ulcers, it is now considered a national epidemic and is a matter of urgency. Pressure ulcers are affecting approximately 3 million people. Of those adults, the demographics can range from people with spinal cord injuries such as paraplegics, the elderly, people with diabetes, poor diet, incontinence of urine, someone wearing a caster prosthetic, or for people with more serious diseases such as Alzheimer's, Parkinson's, COPD, and more. We are focusing primarily on paraplegics because they are at an increased risk of pressure ulcers, especially if they do not have the proper education over prevention. One reason that pressure ulcers are a major problem is the recurrence rate. In one of my articles that I researched, it said in 1993, pressure ulcers were noted in 280,000 hospital stays, and 11 years later, the number of ulcers was 485,000. In the 4th Annual Health Grades Patient Safety and American Hospital Study, they reviewed that pressure ulcers have one of the highest occurrence rates, along with failure to rescue and post-operative respiratory failure. The Healthcare Cost and Utilization Project found from 1993 to 2003 that there was a 63% increase in pressure ulcers. Another reason that pressure ulcers are dangerous and widely spread is the risk factors and the effects it has on its patients. There are over 100 extrinsic and intrinsic factors. Some examples of extrinsic factors are friction, shearing, heat, moisture, posture, and excessive pressure. Intrinsic factors include immobility, age, disease, body type, poor nutrition, and exercise. When researching, I also found that wheelchair cushions and footrest can highly impact the severity of pressure ulcers. Depending on the patient, the quality of life can differ. For a lot of patients, pressure ulcers increase the likelihood of mental illness, such as depression, anxiety, and more. The financial aspect of pressure ulcers also plays a role in determining the quality of life of the patient. It has been estimated that the cost of treatment is 2.5 times the cost of preventing them. The average charge per stay is $37,800. However, the cost can range from $38,000 to $60,000. Lastly, about 60,000 patients die as a direct result of pressure ulcers each year. Therefore, pressure ulcers are a debilitating disease that we need to start paying more attention to in order to protect our friends and family.